Welcome to the case files of carotidultrasound.net. We have an unknown case today, and I'm going to show you the ultrasound images. I want you to come up with a diagnosis, and then we are going to review the images together. So our patient of today is a young healthy woman in her 40s. She's found to have a carotid bruit on a routine physical examination. She denies any neurological symptoms, and here are the ultrasound findings. We are going to focus on the right side of a carotid system. Here are the actual images through the bifurcation. Now with color. And here is the proximal internal carotid artery on a B mode image. And here the Doppler flow velocity starting proximally and in the mid-internal carotid artery. And now more distally in the internal carotid artery and even more distally on the right. Das gibt's doch nicht. Also alles wird noch falsch gehen. And here is a color flow image of the distal internal carotid artery. And the same segment on B flow. And a still picture on B flow. So what is your diagnosis? And the correct diagnosis is fibromuscular dysplasia, FMD. Now let us review the ultrasound findings. Here you see the actual images again through the bifurcation. One vessel, now getting into two vessels. This is probably internal, and here's the external carotid artery. Now, and here now with color showing two vessels, external, internal, common now. And you can see that the bifurcation is relatively free of disease. And here's a still image showing just a bit of endothelial thickening in the proximal internal carotid artery, but no evidence of any high-grade stenosis. Here are the Doppler flow velocities in the proximal, internal, mid-internal carotid artery, and you can see that they are fairly normal with the peak systolic velocities shown here. And in the distal internal carotid artery, you see elevation of Doppler flow velocities with a peak systolic velocity of 165. And even more distally, the flow velocities start to drop again. This is the color flow imaging of the segment that shows the high flow velocities. And you can see the turbulence, as well as some structural abnormalities here, which I think are much better seen on B mode imaging here. And you can see areas of dilatation and constriction, something that's called beading of the artery. And here you see it nicely again, as well as on this still image with this dilated part of the artery, and compare that to the proximal portions where the contour of the internal carotid artery is quite smooth. And this is probably diagnostic of fibromuscular dysplasia. Now what is fibromuscular dysplasia? It's a non-atherosclerotic, non-inflammatory vasculopathy that affects primarily the renal, carotid, and vertebral arteries. It's an abnormality of smooth muscle cell and fibrous tissue deposition in the intima, media, or adventitia, and it leads to morphological changes of the arterial wall, such as areas of constriction, dilatation, sometimes high-grade stenosis. It comes to clinical attention during the workup for stroke or TIA, asymptomatic carotid bruits, or other symptoms such as tinnitus, or other non-specific symptoms, and evaluation of the cerebrovasculature. The gold standard is catheter angiography for the diagnosis of fibromuscular dysplasia. And here is an example of that. You see the areas of beading in the high cervical segment of the internal carotid artery with relative sparing of the more proximal portion here and the bifurcation. And here you see an example of this on an MRA of the brain. Now it's very important to realize that different vascular pathologies affect different segments of the carotid artery. Atherosclerosis, which is the most common vasculopathy of the carotid, tends to restrict itself to the bifurcation, and you see an example here where it's really involving the proximal portion of the internal carotid artery, and atherosclerosis tends to spare the more distal portion. And the more distal portion is precisely where we usually see fibromuscular dysplasia as well as arterial dissections. Other conditions that may give rise to high flow velocities in the cervical carotid further upstream are a tortuous carotid artery. Here you see a carotid artery that has a bend, and at this bend you see that the flow velocities are increased, but this artery really lacks the beading characteristic that we saw earlier associated with fibromuscular dysplasia. So what are the take-home points? If you see Doppler flow elevation and turbulence in the high cervical carotid, think fibromuscular dysplasia, be careful, and as dissections or just a tortuous cervical carotid can have very similar findings. Always assess the distal cervical segment of the carotid with alternative ultrasound imaging modalities such as power Doppler or B-flow that may show the arterial wall better than just B-mode or color flow imaging. And the ultrasound findings of fibromuscular dysplasia are probably specific but not very sensitive to diagnose fibromuscular dysplasia. And by that I mean that if we demonstrate the findings, they're likely to be real, but in a significant portion of patients who have fibromuscular dysplasia, you will probably not pick it up with ultrasound because often the changes are distal in the carotid and ultrasound cannot insonate these segments reliably.